Hi, my name is Brianne Letta, and I'm a Stony Brook University graduate. I spent my final year at the university working on a story about the pandemic at Stony Brook University Hospital. And true to the past year, I'm filming this pandemic style, which means I'm filming it from my living room with my phone and a TikTok light. But I'm going to sum up this story, which I've written below, the best I can. So to start, let me take you back to February 2020. Gary DeGry is a 49-year-old veteran and postal service worker from Bellport. During February, at this point, he's noticed the beginnings of a rash that would eventually cover his entire body. He goes to the doctor, who prescribes prednisone and Benadryl, but his symptoms only escalate from there. Soon he has a cough and a fever, and in mid-March, he calls out of work to get tested for COVID-19. A week later, he's in Stony Brook Hospital.
From what I found out, they had just opened up the COVID unit, a new floor at Stony Brook, which I think at the time I was initially on 11 South, and then I think I moved to 18 South. At that time, the COVID unit opened up. I was the second COVID patient admitted, and probably the sickest, they told me. I had a doctor there. His name was Dr. Jerry Rubano. He was giving he was put in charge of this new COVID unit. And he took care of me from that moment on to the moment I left. He refused to give up on me.
By the end of February, the United States had 68 confirmed cases of COVID-19 and 1 death. Like most other countries around the world, the country would struggle to contain the highly contagious virus. This was only the beginning.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
Stony Brook estimates that more than 400 patients in the hospital were being treated for COVID-19 at the pandemic's peak. The journal article estimates that about 3,500 cases of COVID-19 passed through the hospital between February and April. Meanwhile, Gary's health continued to deteriorate.
Unfortunately for me, when I did get admitted that day, after a week's long prior to that the week prior to I got progressively worse. My symptoms just I didn't have many symptoms prior to when I caught COVID. I didn't have a fever. I didn't have cough. I didn't have certain things. But over that course of that week prior to, I got considerably worse. So when I went into the emergency room that day, I never left.
His wife, Anna DeGry, rushed him to the emergency room on Sunday, March 22nd, 2020. Now, doctors are finding that many patients who supposedly recovered from COVID-19 are still suffering from what they've dubbed long COVID. Stony Brook University Hospital, which includes a trauma center, is the only tertiary care hospital in Suffolk County. It admits about 34,000 patients and treats more than 100,000 in its emergency department each year. So with access to more resources than many other hospitals on Long Island, it's no surprise that Stony Brook fronted the battle against the pandemic here. It didn't take long for physicians at Stony Brook and around the world to realize that the virus causes blood clots, which can lead to pulmonary embolisms, amputations, and heart damage. Stony Brook physicians found that patients with no history of heart disease were suffering from heart attacks and strokes. Physicians studying the bodies of patients who had died from COVID-19 found excessive clotting in their blood vessels. By the end of March, gastroenterology fellow Rashmi Advani knew that life wasn't going to go back to normal anytime soon. Before the pandemic, Advani, who has been a physician for 5 years, felt that as long as she was in control, she'd be okay. Her patients would be okay. But life was no longer predictable.
Imagine going into work and thinking that today might be the day I might get exposed, or today might be the day, like after I get exposed, some days after this, I might be intubated in ICU. That happens. That happens to doctors, that happens to nurses. So many people in the healthcare field have already died from this disease.
The hospital pulled together as many ventilators as it could. It even adapted anesthesiology machines from its operating rooms to breathe for patients in the intensive care unit. But the hospital never ran out of ventilators, nor did it run out of personal protective equipment or critical drugs. Carol Gomes, the hospital's chief executive officer, said that the hospital provided a resiliency room for its frontline workers with psychological services, snacks, water, and a place to rest. Nurses from Upstate Medical Center in Syracuse came down to help in early April, and the Renaissance School of Medicine graduated its senior class a few weeks early to join the hospital ranks. About 50 were ultimately hired as assisting physicians.
Working in a hospital, there are many potential disasters or emergencies that can occur, and we are always drilling and preparing for these emergencies, but never on the scale of this pandemic have I experienced such an emergency. You know, we've had hurricanes, we've had earthquakes, we've had floods, but the pandemic is nothing like I've ever experienced. So this is very different, but I can certainly say we were prepared because we did drill for this type of an event and we were ready.
Is there anything that you would like to add?
Only that the only thing I might add is that, again, I'm just extremely proud of the team and the level of enthusiasm and energy that was experienced during a period of time when it was quite difficult, and when people saw how serious it was, that not only did we support our patients, but the team supported each other. People took time to ask, how are you? How is your family? Are you okay? And helped each other through it. And even to this day, we still are asking some of our team, you know, are you still okay? This has really deeply impacted and affected them. And it will always be with them. And so we just want to make sure that we provide the necessary support.
COVID-19 cases started to wind down during summer of 2020. Michael Kelly, a paramedic, could track the patients being taken off ventilators or discharged because the hospital would play the Beatles classic Here Comes the Sun over the paging system. Starting in October, though, COVID-19 cases started to surge again, with daily death tolls regularly setting new records. In early January, more than 4,000 people died in a single day. That's more than the number of people who died on 9/11. At Stony Brook, though, there were fewer than 200 patients being treated for COVID-19 in mid-January. That's fewer than half the number of patients who were being treated at the pandemic's peak. But if there was a flicker of hope in the darkness, it came with the advent of vaccines. On December 11th, 2020, the U.S. Food and Drug Administration gave emergency use authorization to the Pfizer-BioNTech vaccine, which has a 95% efficacy rate. Just 3 days later, the very first shots were given to healthcare workers across the country, and the very next day, more than 200 were distributed at Stony Brook. By early May, Stony Brook Medicine had helped distribute more than 350,000 vaccines. The CDC issued guidance in mid-May lifting mask mandates for those who are fully vaccinated, both indoors and outdoors. Now suddenly, cinemas and malls are opening up. Broadway theaters are coming back in September, and musicians have announced upcoming tours. And after 474 days, New York lifted its state of emergency on June 24th. Gary DeGray has made what his doctors have called a miraculous recovery. He still suffers from brain fog and nerve damage in his right hand, but he no longer needs to see a cardiologist for arrhythmias in his heart, which stopped 2 or 3 times while he was in Stony Brook University Hospital.
I never thought that this would ever happen to me, and it did. Why, I don't know, but it did. But I made it. I pulled through, and I'm glad. And I'm dealing with it, dealing with these these symptoms afterwards, and they termed us long haulers. So I'll just deal with what I have to right now and try to do the best I can and keep on working at this and getting stronger.
Now, as summer approaches yet again, the atmosphere at Stony Brook University Hospital is one of cautious optimism. A board near the Health Science Center garage has listed fewer than 40 COVID-19 patients for the past few weeks, a rate reflective of the infection rate in the county. This time last year, there was more concern and uncertainty. Healthcare workers were still embedded in the deadly daily battle against the pandemic. But now there's a greater understanding of the disease and how it's transmitted. Vaccines are widely available in the United States when only a year ago they seemed like a distant hope. Most of America, ravaged by death, financial hardships, and other conditions exacerbated by the pandemic, is still struggling with the consequences of the past year. But as the country and Long Island and the county inch closer to that still elusive herd immunity, we can hope at least that things are on the mend.